glucose tolerance tests are performed on people suspected of having hyperglycemia, which is a high blood sugar level. We do a standard GTT, which is a 2-hour format. We also do a modified GTT, and we can also perform a glucose challenge, which is performed on pregnant women. The patient preparation for a 2-hour GTT is that the patient must have fasted for at least 10 to 16 hours. They can have had water, black tea or coffee with no milk and sugar. They also need to present in a well state. If they've had the flu or vomiting and diarrhoea in the last week, it's best to advise them to come back at a later date. Patient preparation for a glucose challenge test is there's no need to fast for the patient. Basically, they come into the centre, we record the last 8 time, we give them the 50 grams of glucose, wait 1 hour, and then perform a blood test. Once you have identified your patient, you need to establish a last 8 time. What time did you last eat or drink?
9 o'clock last night.
Excellent. You fill out another form which is associated with a glucose tolerance. It's for pregnant or non-pregnant patients. You just need to fill out the correct box. So for this particular test, we're doing the standard 2-hour. So I usually cross out all the others. And we need to write the time that we're collecting the fasting sample, which will be 9 AM, and our collector's initials. Instructions for the actual glucose tolerance are written in the box. It'll tell you how much glucose to give the patient and when to collect the samples. So for the standard 2-hour test, you collect one at a fasting time, which is 9 AM, and collect one 2 hours later, so the time difference should be roughly 2 hours. Once you've correctly identified your patient, you then need to make sure you get a BMI. It is essential when you perform a glucose tolerance test. In your centre box, you need to clearly indicate a last 8 time. This is very important for the laboratory. The essential information that you get in your centre box is to stamp, a billing code, the time and date of collection, also the collector's code or initials. You definitely need a last 8 time and how many hours that is, PP. You also need to make sure you get a BMI for a GTT. Once we've completed all the paperwork, we then collect a fasting sample from the patient. This is collected in an SST and it needs to be clearly marked with a fasting sticker on the top, so the lab knows which is the fasting sample. Just press there for me. Invert your tube 8 to 10 times and then label it with all the correct information. So the patient's surname, first name, date of birth, time of collection and date. And with the glucose tolerance, we need to then label it with 0-hour GTT and our collector's initials. You must write 0-hour GTT on the fasting tube and then 2-hour GTT on the second tube, so the lab can identify which one was the fasting and which one was the 2-hour glucose tolerance. In the lab, they're going to receive 2 samples with the same patient and the same test, so they need to be able to clearly define which one was the 0-hour and which one was the 2-hour. Now we need to ask the patient to make sure that their details are all correct on the tube. Please check your details on the tube. Just spell it back to me so I can understand that it's all correct.
SMITH, Leslie LESLIE, 161047.
Is that all correct?
It is, yes.
Excellent. Now that we've collected our blood, we'll instruct the patient to have the drink. But you drink this within 5 minutes. Once you've completed the whole bottle, you then need to press the start button, and that will start the 2 hours. If the patient vomits within the first hour of the test, we have to discontinue. If it is after the hour, we need to ring the laboratory for guidance on what to do. Once the 2 hours is up, put the patient back into your room and collect another blood sample into an SST. You tell your patient not to turn the alarm off once it's sounded, and as collectors we need to make sure that we get the patient into the room as quickly as we can because it is a timed test. If there is a time delay for whatever reason, we need to make sure we note that on the form. Once we've collected our fasting and 2-hour blood samples, we need to band them together and transport them to the lab like this. We then offer our patient a refreshment. They're going to have a substantial drop in their sugar levels and we need to make sure they get home safely. So by offering them a juice and a biscuit, this should sustain them until they get home.